They need to have a scapegoat.
Attorney Brian Hirschman says Multicare's Good Samaritan Hospital in Puyallup and health officials are looking to pin the blame of a hepatitis C scare on his client.
What they know is they're facing civil litigation and they've got to find a scapegoat. What better person than a person who's got some narcotics issues, right?
Good morning.
Earlier this morning, Puyallup police say they helped Canadian and American law enforcement arrest the nurse at the border Thursday night and said time was running out.
I think that without her travel plans, we would have liked to have developed some more evidence, but again, we're working under a time crunch with her leaving the country.
And while health officials say the two original patients who tested positive for hepatitis C are linked by the virus's DNA, they can't yet say the same for the nurse.
Is it ever possible, do you think, to determine whether or not this nurse spread this particular strain or whether or not she contracted it from these two patients?
That's a good question. I think that's something that we would be asking in the investigation. Again, keeping our eyes open for all possibilities.
Multicare believes the nurse was stealing drugs, but does not know how the virus was spread to two patients. On Monday, the hospital sent letters to more than 2,500 patients who may have had contact with the nurse inside the emergency room and urged them to get tested.
I got a call yesterday, and they were able to tell me right away after verifying my information that I was negative for all 3 tests.
Erin Sadeloff was one of them, but she still has a lot more questions about how the virus spread.
They don't understand the mechanism by which this transpired, and there's just no way unless they caught it on camera or they had, or she admitted to it.
Meanwhile, the nurse's attorney insists she's being blamed for something she couldn't have done, even if she may have abused drugs.
In the Pierce County Jail is a young lady in a suicide smock who is an outstanding nurse, who's a committed professional, who is experiencing psychological trauma because of the commitment she has to her job, saving people's lives.